Hi guys, welcome back. It's Dr. Saru. Welcome to another episode of Med in Practice. And today we're going to be discussing a very interesting topic as usual. So come. Have you ever had a problem, or have you ever had this experience before of feeling pain during intercourse? I thought you should know some of the reasons why you can feel pain during or just before, immediately after, the intercourse. And also what I'm going to discuss with today is when you should see a doctor when you've been experiencing these pains. So, pain during intercourse it's a pain or discomfort that a woman feels either on her labia or the vagina or the pelvic area. So it can be described as deep pain or burning pain or sometimes a sharp stabbing pain. So now that we know how it can be described as, you would want to know the causes as I promised. So one of the most commonest cause is under lubrication. When you don't have enough moisture or enough lubrication at that particular region, because of one reason or another, sometimes it can be medical, maybe it's because of low estrogen levels, it could also be because of the change maybe in age, like in menopause. So one of the most commonest is poor or under lubrication, of which when we know the cause, then we treat accordingly, but we'll go to that. Let's continue with the causes. So cause number 2. Pain might be described especially in ladies who are having intercourse for the first time. So if it is your first encounter, you might describe the pain, you might describe the intercourse as being painful. Reason number 3 or cause number 3 is change in sexual behavior. And then the fourth reason or the fourth cause of painful intercourse is STI or any sort of infection, not necessarily sexually transmitted infections, but also other infections that maybe you might be having PID. As in most cases, PID is caused by STIs too. We are in point number 5. The fifth thing could be injuries or irritation. So you could have been injured because of any traumatic event, such as childbirth, or maybe you had a tear because of one reason or another, or you got irritated because of some practices that you're doing or something that you put inside there that irritated it. That could be one of the reasons to cause painful intercourse. The 6th point is vaginismus or vaginal muscle spasms. It happens in people who maybe might be undergoing some psychological issues, and sometimes you get the spasms, and that can also be a cause of painful encounter. Infections we've already discussed, such as UTI, I said, or PID. So now we go to the 7th point, which is skin conditions. You might be suffering from some skin conditions around the vulva or around your vaginal orifice, and during the intercourse, it's definitely going to be painful. And the 9th thing, before I forget, which is also one of the most commonest causing even the vaginismus, is psychological aspect. So now that we know the causes or some of the causes that for one to have painful sexual encounter or intercourse, we need to know when can we seek for help, or how do you know it's reached that point that you need to be seen by your doctor or your gynecologist, either a general practitioner or a gynecologist. And then depending on what the cause is, we're going to refer accordingly. So if it's a new pain, for example, you've had sex before in your life and you've never felt this kind of pain, and this is just the time that it's starting, that is also a good thing to go and get checked to see why you've started to develop the pain. The second thing is if you're already maybe experiencing a bit of some pain, but it keeps on gradually increasing or worsening progressively, then that is a reason as to why you should also come and get to be seen by a doctor. If the pain also is accompanied by bleeding, the third thing, please get yourself to the hospital. And number 4 is discharge, whatever colored discharge, if it's offensive and definitely not the usual discharge that you're used to, you need to also take yourself to the hospital. You need to be seen by a physician or a general practitioner or a gynecologist. So guys, now that we know what the causes are and when you should seek for help, I thought maybe I help some people out, especially when maybe you just know what are some of the things that you can do from home to help with the situation. Is assuming you already know that you have you've been told maybe it's just because your vagina really dries out really fast. You can try to buy artificial lubricants. Water-based lubricants are very safe and will make you have a better experience other than having the pain. If maybe it's because of some psychological issue, or maybe there is lack of enough foreplay, you can always discuss this with your partner so that you can have proper foreplay, which will in turn make you well lubricated. Again, we're trying to make the area so moist so that it does not really hurt when you happen to be having the experience. Until next time, it's Dr. Saru. I hope you enjoy your weekend. Love and love.